I've seen people in the mall that, their left foot may be out at a 45-degree angle. And they're like lumbering along, which tells you like their left hip is probably flared out, or
Right.
someone's shoulders dropped on the left or the right, or the
Yeah.
head is cocked to balance them, or they walk with like, their hips are forward or their hips are back, or their head is forward. I see all
Right.
kinds of weird, now that I'm aware of it, I see all kinds of distortions everywhere.
Yeah. And those are all clues as to how somebody is utilizing their body to get through space and their airflow, because a lot of it has to do with how we are able to manage our pressure internally. And a lot of it has to do with how we move through space. And they're actually, one and the same thing. So we see a lot of these compensations occur, and it's not something that happens overnight, but it's years of buildup, the same way that someone's breathing is also years of buildup. So when we look at posture and people come to me, I want a better posture, which is like the cool way to look at my profession. In the end, if someone comes to me with chronic pain and they have a not suboptimal posture, if we work on the pain and get them into a better position, then ultimately their posture is going to improve as well.
So again, what's an example? What's a very common complaint someone has, and what would you do to fix it, for instance?
I mean, I get low back pain all of the time, and there are different postural restoration techniques that I can use to get somebody out of that low back pain. Now, that low back pain could be because they have pelvises on both sides, acetabulums that are forward on both sides, and could be putting that extra strain on their back. And, we can do 3 techniques right then and there, and it could alleviate it. Our techniques always have some sort of respiratory component. They have a lot of visual components, even dental components in these breathing techniques. They're not strength and conditioning exercises. They're specific breathing techniques, and they're designed to teach the brain how to understand its space. So they're very intricate techniques, and they can make really significant changes. Whether the changes happen right there, not everybody gets changes immediately. Many people do, but sometimes people get changes later on.
Well, what's like a position you'd put someone in? Maybe the easiest to describe, since we're not on.
Oh, they're
on
very
video.
torqued. Yeah, they're very torqued. A lot of our positions are very complex and torqued because of the understanding of that our human body is asymmetrical. So, for example, we will do a lot of posterior pelvic tilting, but that's quite basic in postural restoration. The more advanced things would be where we have the entire thorax on the right side open so that the person's able to breathe into that more compressed right side, because with the diaphragm being bigger and having a lower attachment on that right side compared to the left side of the diaphragm, as well as the 3 lobes of lung being on the right side and only 2 lobes of lung being on the left side, as well as a liver in that right side of our thorax, we have more compression in that right side. So in order to get the airflow to be even inside of our thorax and understand that this is a pressure system, we will utilize even balloons, but also different torqued positions. I like to use the word torqued because that's ultimately what it looks like, although those positions are actually giving that person more symmetry in the end, because now we're doing airflow in this torqued position. It's giving that person the ability to breathe where they could not properly breathe before.
Well, what are some, we got the natural asymmetries in a body, but what are some asymmetries people have, and what's an example of one that would cause them a problem?
So, like I just mentioned, that right liver, or the liver that's on the right side, and then the right diaphragm, and the 3 lobes of lung on the right. We also have a longer vagus nerve on the right side. We have our brain hemisphere that on the left hemisphere controls the right side of the body, and there's just more neuromuscular connection there. We will see a lot of certain asymmetries, but that doesn't mean that I always see that. So you mentioned the left foot turning out before. I typically don't see that as often as I see a right foot turning out. And there's a reason for that. So, right foot. So
what's the reason?
The body weight is more over on that right side because of these asymmetries. And therefore, we'll see people turn their right foot out or get bunions. But that's not to say that someone's not going to have a left foot that turns out. There's different reasons for that. So all of these little clues that we see in the body tell us how that person is managing. So I'll see a lot of compressed right rib cages, a lot of hips on the right side that are more elevated compared to the left, because that, right rib and right hip, that whole area right there is more compressed towards each other. We'll see a lot of left ribs that are extremely elevated and lifted upwards, so very hyperinflated on that left side. But we also see hyperinflation on both sides. We see left ears that are a little bit more flared out, more visible when you're looking at somebody's face. We'll see right eyes that are lower compared to left. So but at the same time, I also see opposite of everything I just said. So there's a reason as to why it would be one way versus the other way. And that's where postural restoration gets very interesting, because these are all patterns that we see because of the internal asymmetries we have, because of the way we developed, because of our childhood, because of who we are as a person, our personality, and even things like retained reflexes can cause asymmetries. So I've been diving into other things, but definitely like just learning about the world of asymmetry is fascinating to me.